Harvard Medical School. How concerning is it to you that here in New York State, the rate of infection for coronavirus is doubling every 3 days?
It's very concerning, Laura. You know, New York State comprises 4% of the world's population and already has met 5% of the world's cases of coronavirus. And of course, the cases, as you mentioned, are doubling every 2.5 to 3 days. Unfortunately, these numbers are also obsolete by 10 to 12 days. They don't reflect any of the infections that may have transpired in the last 2 weeks. And so we're only really detecting a fraction of the likely infections across the country.
Now, President Trump wants to get America back to work in 2 weeks. How risky is that when the virus, as you say, is still spreading?
Would be morally irresponsible, dangerously short-sighted, and empirically unfounded. You know, if President Trump were to listen to any of his scientific, public health, or medical experts, all of them would say that right now we need to be maximizing physical distancing measures. We need to follow the lead of UK, of India, who just today announced a nationwide lockdown and ensure that not only 43% of Americans who are currently under shelter-in-place orders are affected, but the entire country is under a shelter-in-place order. And we need to do that for at least 2 to 3 weeks. Relaxing the stringent rules that we have presently on social distancing and physical distancing measures would endanger the entire population, not merely the elderly, who President Trump seems on quarantining instead, but young people as well, who, as the CDC reported just last Friday, comprised 20% of hospitalizations in our first study, 56% of those in New York. So this really would be terrifying for the entire country and not at all the appropriate next step in this crisis.
There's a big spike in infections in Louisiana. Are you worried that hospitals there might not be able to cope? Just as it's here in New York, they could be overwhelmed too.
Yeah, I'm worried about a number of places. I'm worried about hospitals in Louisiana, in New Orleans, in Florida, in many rural parts of the country that simply don't have the resources or the number of health centers that cities like Boston, my hometown, currently have at their disposal. And we're seeing as well that preparation itself is being politicized. So states with Democratic governors, with Democratic legislators have invested significantly more resources in preparing their hospitals and in purchasing protective equipment than their red state counterparts. And that's unfortunate because in a crisis like this, we need to lead with science, not with spin. And that's not what we're seeing right now.